Olofinle. She is a seasoned cybersecurity and privacy professional with expertise in information security governance, risk and compliance, identity and access management, DevSecOps, vulnerability management, crisis management, and data protection. She is a 2025 nominee for the prestigious Cybersecurity Woman of the Year Awards, recognized for her outstanding contributions to the field and her commitment to advancing cybersecurity and data privacy. Her passion lies in helping organizations build strong and practical security frameworks that align with their unique needs and comply with industry regulations. She brings a proven track record of safeguarding business from digital threats while ensuring the privacy and protection of sensitive data. Yetunde combines technical knowledge with a clear results-driven approach. She works closely with cross-functional teams and effectively communicates complex cybersecurity and privacy concepts to stakeholders at all levels. She believes in fostering a strong security culture and integrating cybersecurity seamless into business and operations. So thank you very much, Yetunde, for joining us today. And we're very pleased to have you today to talk to us and share a wealth of knowledge with us. Thank you so much, Yetunde.
Thank you very much for having me. It's a pleasure to be here.
Awesome. So today we are going to have, Yetunde is going to give us some intro as to what she thinks about cybersecurity and healthcare, and why we decided to mix this together, why there has to be that conversation around cybersecurity and healthcare. And we're then going to have a chat with her, ask her a couple of questions, and then see what she thinks about or her perspective on a couple of things that are happening in the section of cybersecurity and healthcare. So what you Yetunde, what really, as in more or less, why should we have this conversation about cybersecurity and healthcare?
Thank you. So I believe cybersecurity, privacy, and healthcare, it's a conversation that we do not have often. It's underrated, and I believe we should have more of this. So first of all, I just want to say thank you for this platform to push this kind of necessary and very critical conversation. Because we talk about cybersecurity a lot, we go for webinars, we have conversations, but I barely see like a sector, industry specific, especially for healthcare. And it's important because now in 2019, there was a ransomware attack. A particular clinic, I think Spring Hill Medical Center in Alabama was attacked, suffered ransomware attack. And the ransomware sort of crippled into their systems, their monitoring tools, and their equipment, and they were unable to, carry on their healthcare services as they could and as they would have. And that tragedy led to a death of a child, of a newborn. And we see that because a lot of their systems, a particular system that would flag if there is a complication in maybe delivery and all of those, was unavailable due to this ransomware attack. Now, we saw that a life was lost, a life of a newborn was lost due to this ransomware attack. And it shows that, it goes to show that it's not just a technical issue, it's beyond even data. Oh, my data has been stolen. Now, lives can be involved, just the way we've seen the example I just cited. So like I said, it's a conversation that is sort of underestimated. It's a conversation that we don't get to push enough. And I think it's very important that we start having these conversations, especially around healthcare, especially around human lives, because human life is involved. So cybersecurity lapses in healthcare is not just going to lead to financial. There's financial aspect of it, there's reputational damage of it, but there's also life, which is the ultimate price, or ultimate consequence. Like then also I would say that now in hospitals, clinics, we are seeing a huge adoption of technology. We are seeing AI-driven diagnoses, telemedicine, even remote care platforms. We are seeing wearable devices, all those devices that we wear to measure your heart rate, your calories, and all of those things that we use. And it's important because these are technology-driven, tools. And it's important that we also talk about, we prioritize cybersecurity and privacy as we continue to adopt this, because with this adoption of this technology, with this advancement, is increasing the attack surface. So there's something we call attack surface in cybersecurity. So it's increasing the attack surface and is giving these cyber attackers like a larger, if their playing ground was maybe just like 1 meter, now they have like 10,000 meters. So it's giving them a larger playing field and it's increasing our attack surface. So it's important that we prioritize, the way we prioritize safety, the way we prioritize, safety and human lives and medical care in health care. It's also important that we start talking about privacy, we start talking about cybersecurity, because the impact goes beyond financial damage, financial loss, reputational damage. It could actually cost lives. I'm just going to, pause there and, yeah.
Beautiful. So that's actually a different perspective, because most times we just focus on, oh, they stole my data, my information was compromised, but we actually don't talk a lot about the impact on the loss of life, the potential loss of life, the impact on care, that breach of care, that the continuum of care is breached. So that's actually a very interesting perspective. And I just want to hear from you, like in modern healthcare now, like you said, the attack surface, I'm going to learn a lot of new words today. So the attack surface definitely has increased. There's more playing ground for these folks. So in the world of today, in modern healthcare and in digital healthcare space, what do you see are the biggest cybersecurity threats that you can say is facing the modern healthcare system or ecosystem?
Yes, so I'm going to start with the first one that I just mentioned, which is ransomware attack. Just as the example I shared, that a life was lost because some tools, some data, some information were unavailable. Ransomware, let me just quickly mention that ransomware attack is that kind of attack where your data becomes unavailable, or your data is encrypted and you need to pay a particular ransom, like a particular amount for that data to be released to you. So you won't be able to use, you might not be able to use some equipment, and some tools might become unavailable. So majorly, that's what a ransomware attack is. And we are seeing like that high rise of ransomware attack, and now in the healthcare as well. Then also there is also phishing. There is phishing and social engineering. So phishing is you getting emails, unsolicited emails, and for the sole purpose of you clicking on, maybe there will be like a link, or there could be like an attachment. So you click on the link, or you click on that attachment, and it takes you, if it's a link, it takes you to maybe a platform or a portal where they might then request for your credentials, and you enter your credentials and they harvest your credentials. It could also be maybe like an attachment where you click on that attachment, you download that attachment, and you're downloading like a malware to your system that could actually encrypt your data, or just corrupt your data, or do some havoc, or it could just harvest or steal some data as well. So social engineering, phishing is a form of social engineering. So social engineering is a bit broader. So it could just be maybe somebody is calling you and asking some questions, and you think those questions are very harmless questions. What harm can they cause? But they know, like, it's part of a puzzle. So they know what they want to get from that conversation. And when they put those puzzles together, it forms a big information. It forms like what they can use to deploy their targets. So that's another one. There is also big risk, and I mentioned advancements in technology. We've seen how technology has advanced. We are talking about IoT, Internet of Things, and this is, so in the healthcare Internet of Things is no longer like it's a lot of clinics, a lot of hospitals are actually embracing this, where tools can, like they can, like your tools can tell you when it's time for servicing, when it's time for maintenance, this and this and that. So that level of, IoT. And so with these devices comes vulnerability as well, comes risk. And sometimes because of the nature of how things like 247 in the healthcare space, in hospitals, they're always working. It might be difficult to patch. So patching outdated softwares. And so because of the nature of the work in the healthcare space, so it might be difficult, or it might be difficult to patch some of these outdated softwares, and that becomes a major risk as well. Third-party risk is another, and it's not just healthcare. I think third-party risk is a growing concern across board everywhere. Also, narrowing it down to healthcare. So within healthcare now, we have healthcare service providers, you have the labs, you have different providers, different healthcare providers. Now, do you have oversight of these providers? What level of access to patient records do they have? And this is another area that we are seeing a lot of risk lately, and we need to pay attention to how we can manage risk, how we can have visibility of our data flows across systems, also to third party. I'm just going to pause, but we have these are top risk that healthcare today face.
Okay, thank you very much, Yetunde, for that. So from this, you said ransomware. Now I understand the meaning of ransomware. It comes from ransom, to be able to take away that the threat they've put in your system or your service. Then phishing, the usual phishing that we know, social engineering, third-party risk. So these are some of the things that the threats that we face. So coming to healthcare now, many healthcare facilities or healthcare organizations will not really prioritize cybersecurity. They don't. Like when it comes to certain things, it's not top on their list. And that's probably because of costs, or they haven't just seen the need to really prioritize cybersecurity. So what are some practical low-cost measures that you think organizations that are in the healthcare space can adopt right away to protect their information and the data of the people that go to those organizations or they take care of?
Very, very important question. Okay, so a lot of times when we talk about cybersecurity, we often think tools immediately. What comes to mind is all those gigantic tools that we use, all those very sophisticated tools. But really, cybersecurity is not necessarily about tools. It's about people, it's about processes, about technology. So it's a combination of all of this, not necessarily, the technology aspect of things alone or the tools aspect. And you can have a robust cybersecurity without having the latest high-tech systems or tools. I believe it's coming from a misconception that cybersecurity, tools, you're looking at all those big tools, it's really more than that. And like I said, it's about people, it's about processes. The little things we do really matter. From having a clear processes, having a culture of vigilance, a culture of cybersecurity. And what can we really do? Okay, one of the things I think I left out when I was talking about the risk is also insider threats. This is something that we've seen also across industry, across sector, not just healthcare alone. We've seen, and this insider threat, it could be malicious, it could also be accidental. It could be that maybe somebody is trying to be malicious, or maybe somebody is colluding with someone outside to sell data. And it could also be accidental, somebody who has suffered, who has been a victim of social engineering, a staff of the hospital or a clinic or a healthcare service provider has just suffered or has just fallen victim of social engineering. So that could be accidental, like I said. It could just be somebody accidentally deleting something that's supposed to delete, or accidentally sending patients' records to unauthorized individuals. So, and that brings me to why training is important. I think the people side of things of cybersecurity is as important as the tool side, as the technology side. So we need to train our people, our staff, and not just IT, not just people in IT say, oh, okay, IT or the security team will deal with that. No, everybody within the organization, within the hospital, within the healthcare sector has to be trained. Also, enforcing strong password. We don't really need the most sophisticated tool to enforce strong passwords. We multi-factor authentication, having maybe OTP and this, you're not just relying on password alone. I think those are little things we can do. Also, creating a simple incident response plan. In cybersecurity today, we say it's no longer if. Before we say, oh, if it happens. Now, we've seen time and time again that even the biggest or the most advanced technology organizations, they also get attacked. So it's not about if a cyber attack happens, it's now when it happens, because it has not happened to your organization today, does not mean it cannot happen tomorrow. Now, when it happens, how prepared are we? So we're talking about resilience. We need to be prepared. So we need to have a robust incident response plan. It's not when it happens, we're now running the task that there will be chaos. So we need to have like a response plan, robust response plan, how we're going to respond when this happens. We also need to know our data. We need to know, I talked about third party, like visibility of your data flow. What kind of data do you collect? Fine, you collect patients' record, but what exactly do you collect? What kind of data do you store? What kind of data do you share to third party? Who do you share to? Or we also need to have visibility of our third party. So we need to have a list of at least the barest minimum, have a list, to have a record of your third party, your providers, and what kind of service are they providing to you? What kind of data do you share to them for them to be able to provide this service? And what kind of clauses, that would determine what kind of contracts are we signing with them? What kind of clauses should we include in those contracts? Like your, cybersecurity, like confidentiality, integrity, all of those clauses, your business continuity clause, your data protection clauses, all of these clauses should be there as well. Then beyond even just the contractual agreement alone, also what level of involvement do we audit them? Do we assess their risk? And we should also do that as well. Then regular backup. So I talked about ransomware, like ransomware will encrypt your data. One of the ways to maybe avoid paying that ransom could be that you have a backup. So your data is encrypted. You can then, if you have a backup, you can restore your backup. You might be able to use that. So that's another thing. So keeping regular backups off-site as well, not just backing up in the same system that you're using, because when that system becomes unavailable, then you might not be able to access your backup as well. So having a backup off-site. Access control. We don't need the beyond trust of this world. You don't need cyber hack of this world. If you can afford those, great. But if you don't, you can, little things as maybe taking stock of who has access to what, especially in the healthcare where we have different roles. You have nurses, you have doctors, different roles. So what access does this person need? Everybody should not have, it's not like everybody should not, it's not like a flat kind of where everybody has the same access. Everybody shouldn't have the same access. You should be on a need to know, least privilege, whatever you need for your role is what you should have access to. And I talked about patching as well. I know that the nature of how things are might make patching a bit difficult, but we also need to, it's very important, we also need to prioritize, because unpatched systems, it's a risk within the organization. So we also need to take patching seriously. But beyond all of this, or most importantly, is training that I've mentioned. I just want to also wrap it up with conducting training and awareness. There's not too much of training, there's not too much of awareness when it comes to cybersecurity and privacy.
Some of these things I used to think they were just for financial, institutions, the multi-factor authentication, OTP, incident response plans, the CIA, having all these clauses and being sure of the clauses with the third party. So you have contracts with regular backups, actually, which we do with our phones, and access control, who has access to what. So these are some things you've mentioned. Of course, training is always there, having that training so that people don't click on things that they shouldn't click, and also shouldn't share what they should not share with other people. So this is actually very interesting. So I know that in Africa, because I mean, DHSA is an African organization and we look at African solutions to African problems. I don't know how much, I mean, cybersecurity is an area I'm really great about, but are there some lessons we can draw in the cybersecurity space from more advanced countries that we can adapt using our context? Are there some lessons you think, oh, this is how this is working here with, I think this can work in Africa, given how our systems are? Are there some lessons you think we can apply?
Yes, absolutely. I believe so. So I'm going to use, because we're talking about cybersecurity and privacy, right? So I'm going to use, let's use GDPR, for example. I know that in the EU,
Can you explain what GDPR is for those who don't know?
Okay, yes. So GDPR is General Data Protection Regulation. That's the full meaning. And it's used in the EU, across the EU. Yeah, so it was, I think it was enacted in 2018. Yeah, it came about in 2018, and because they needed to have like one unified framework as to how to address data privacy issues, data protection issues across EU, because you don't want different countries to have fragmented, laws that maybe I need to comply. If I need to do business with, for example, maybe Germany needs to do business with Poland, then Germany would then have to, they'll have their own data protection law. They have to comply with Poland, to remove that kind of ambiguity. That's why GDPR came about. Now, back to the question. So I said, GDPR, having GDPR across the EU, what I've seen is that in terms of compliance, GDPR mandates if you process personal data that belongs to EU citizen, you must comply with GDPR, or you have to comply with GDPR, regardless of where you are, regardless of where you are doing business from. So far you collect our data, you have to comply with the GDPR. And beyond just having that policy or that regulation, there's also the enforcement side of things. GDPR forces organizations to comply, to go beyond even checking the box, to actually practice real data protection or real cybersecurity, because there are sanctions. If you are found wanting, if you violate the GDPR, if there's a data breach and they do their investigation and they found that a particular organization had violated the GDPR, then you would pay. And the sanction is not even cheap. Is 4%, 4% of your total annual, turnovers, not even profit, your revenue. Or you can, you can pay as much as $20 million, 20 million euros. That is, if 20 million is greater than your 4%, you pay 20 million. But if 4% is greater than your greater than 20 million euros, you pay that 4%. So what that does is that a lot of organizations, they sit tight. You can't, you don't even, because they will collect that money. And some organizations that maybe they are not even as buoyant as that might take you out of business. So a lot of organizations just sit up and make sure that they comply with GDPR. Now, Nigeria and, Africa, but Nigeria specifically, we have the NDPA, which is the Nigeria Data Protection Act, which sort of mirrors the GDPR as well. And in terms of the law, I think it's robust. It's robust enough. However, in terms of enforcement, there is a gap. We don't see, because if you in the news today, if you just type top data protection or privacy breaches or sanctions, you will see a whole lot around what GDPR, sanctions from GDPR. But in Nigeria today, we don't really see that. I think in Africa generally, even though we have, across Africa, there are data protection laws. Outside Africa, they have the POPIA. In Kenya, they have Ghana. A lot of African countries too, they have data protection laws. In Nigeria, we have data protection law as well. But there's still that low level of maturity when it comes to enforcement. And we've seen that if you don't go after non-compliance, people would think it's okay to breach these laws, to violate these laws. But when you start seeing a lot of consequences in terms of non-compliance, then if organization, hey, will be like, oh goodness, if NDPC, for example, NDPC is the body that regulates data, that sort of regulates data protection law in Nigeria. So if NDPC could go after organization A, then that means they can come after us. So they beginning to see that cases like that, then I believe that we'll start taking this seriously. So I would say that in terms of what we can learn from what is going well with other countries, especially my reference point is the GDPR, which is in the EU. I think Africa has a lot to learn in terms of enforcement. And I think that would really help us in terms of how we take cybersecurity and data protection seriously.
So that you actually answered my next question, which is around how strong these laws are. So apparently the problem is enforcement. We have laws, but really the problem is how much they are enforced in all ramifications. So I believe these laws encompasses health and other things, right?
Yes, they do. Specifically in the US, there is the HIPAA. Yes. So the HIPAA is specific
For health.
Health providers and all of those as well. Yeah, but the ones we don't really have that. So I think okay, that's also I think what we can also do better in Africa as well is to have sector-specific guidance. So why we have the NDPA, Nigeria, for example, why we have the NDPA that goes across all sectors, whether you are in health, whether you are in banking, every sector, so far you collect personal data, the NDPA is applicable to you. Now we need to start seeing sector-specific guidance, so that will then, be like a supplement to the NDPA, to the law itself. So guidance on how these are the specific for example, in the health space. So this is how we should go about it, the how. And I think that would make that implementation easier, across sectors.
Beautiful.
Sector specifics, yes.
Yeah, thank you so much for that insight. And there was something you mentioned earlier about now that we have, with the advent of AI, electronic medical records, these are not foreign to us in Africa anymore. Like BHR is a big topic in Africa right now. And we have artificial intelligence in a lot of programs right now. So what really is your biggest concern? I know you alluded a bit to it, but I just wanted to give us some more insight as to your biggest concern when it comes to data privacy and cybersecurity with respect to these advances in the healthcare space.
Yes, great. So yes, like you said, these are not new things to us. Except you're living under the rock, you wouldn't have heard about AI. You would have heard AI everywhere. Things around wearable devices, Internet of Things, these are no longer like strange things. These are things that we come across every day, right? Now, what are these are technology advancements, and they are here. Technology is always there to make your life better, to make things easier, to make us more efficient. However, technology also do introduce new risk, things that were not there before. Like, for example, artificial intelligence, as much as it has made or is making our life easier, making us more efficient, there's also a lot of risk around, a lot of security risk, privacy risk, misinformation, kind of risk. You can't deepfakes, for example, you can't even tell, there's a way a deepfake can be presented that you might not be able to tell which one is real, which one is not real. So all of these are risks that all these technologies, all these advancements is introducing. And also in the healthcare space, now we're talking about telemedicine, is another thing that's a good thing, right? That we're getting from technology advancement. However, there's also that risk of maybe technology lapses, latency issues, and all of those things. I think generally, we also need to. So I still think regulations can help us, laws can help us in this regards. So having those laws that we had, like the HIPAA, like the GDPR, like the NDPA, some of these laws, some of these laws were enacted, the technology had not matured to where we had today. So I think some of those laws we didn't have, the reality we are currently living in today. They didn't have that in mind when they were coming, when they were drafting those laws. Now that we are where we are and things will continue to evolve, right? I think that having supplement, not necessarily new laws, I don't think we need new laws, but having supplements that will address specifics around, how to manage AI risk, how to do this, how to do that. I think that would also help us. And making sure that, or trainings as well, trainings, creating awareness about these things, about the risk that is embedded in these new technologies as well. I think it will also help. Yeah, generally. But like I said, the biggest concern is security and privacy issues that comes with these innovations, these innovative solutions that we have now today. But they are good things, just that we also need to be mindful of, or we need to be aware of this risk and how we can manage it.
Beautiful. Thank you so much. So guys, if you have questions, please use the Q&A function to drop your questions. If you want to come off mute, you can raise your hand and I can allow you to come off mute to ask your questions. So just let me know if you want to ask any questions. So we're gradually wrapping up our session today. So just let me know, raise your hand or drop your questions in the Q&A chat function. So if you could change one thing today, if you're a genie in the healthcare space, I want you to change one thing. You've given us, you said there's something you can change, can wave the magical wand and change something to strengthen data privacy in healthcare. What would it be?
If I could change one thing, that's a very tough one. That's a tough question, but it's an interesting one. I would say that, first off, I'm not going to, I wouldn't advocate for new laws, right? Like I already mentioned, I think we can strengthen what we already have. But there's one thing there's one misconception that I think is a major issue, is that misconception of data privacy, cybersecurity is maybe just compliance issues or maybe just a technical issue. We don't see it across organizations and not just across sectors and not just healthcare, but in the healthcare sector, we don't see it as priority. The way we prioritize the care, we need to save humans' life. We don't see it as part of, what we should also prioritize. I think if I could change one thing, it would be changing the mindsets. That mindset shift, that this is a big deal. It's everybody's responsibility. We all have a part to play. And cybersecurity, cybersecurity is not just a technical issue. It's not just to be left to the IT and security team alone. Privacy is not just a legal issue. It's not just to be left to the legal team or compliance team alone. We all have a part to play, and we all need to prioritize that. The way we prioritize saving humans, the way we prioritize, providing appropriate and, care to humans, to our patients, we also need to prioritize keeping their data as well, protecting their data as well. I think that's one thing that if I could change, I think that it's going to solve, it's going to solve like 80% of the problems already. Yeah, it's a people issue.
Yeah, it's really a people problem. So there's a question here. So what steps can health professionals take to protect patient data in their hospitals while waiting for these health bodies that we all want to do stuff, like we want these laws to be augmented and all those beautiful things, we want those at the high places to do, to take action. So what steps can health professionals, those in the hospitals, in organizations, take to protect patient data while waiting for these health bodies to take action?
Okay, another interesting one. What can we do? What can we do better? I think that number one, like I said, prioritizing cybersecurity and privacy, seeing it as a business imperative, not just a tech problem or a legal problem. And what that means is that we need to start asking for leaders, like you said leaders, managers, we need to start asking the right questions. Leaders, especially in the healthcare space, they need to start asking the right questions. Questions like, what are our biggest threats today? Cyber threats today. How do we manage them? How do we ensure that, this risk, do not crystallize? Do we have visibility of our data? What do we actually collect? Who do we share data? What's our data flow? Who do we share data with? And all of those, questions around, do we have oversight of our third party? Like, I can give you a lot of examples of cyber attacks that have happened due to third party. A very popular one, Target. I don't know if you're aware, if you know about Target, it's an organization. They suffered a third party attack. And today nobody's talking about the third party. Everybody's talking about Target's attack, but it's actually like a third party, like a supply chain attack. So we need to start asking the right people. Who are our vendors? Who are our health providers? And what do we have oversight? What kind of risk are they introducing? Also, very importantly, is questions around our incident plan. Extremely important. Leaders should start asking. They shouldn't just see it as, oh, God forbid, it will not happen to us, we are protected or something like that. No. So when it happens, when this eventually happens, let's say today now we suffer a ransomware attack. Let's say today we suffer like a denial of service attack. How do we come out of it? What is our plan? How are we going to respond? How are we going to ensure that our operations go smoothly? Things continue to go smoothly. We're still able to deliver babies alive. We are still able to, give the best care that we can. When this happens, how are we going to respond? They need to start asking that kind of tough questions. And when you ask the right questions, that would then, you get answers. So I think that is what leaders should be. Then more importantly as well, leaders in the health space, they need to start leading by example. So you're saying that everybody should take cybersecurity seriously. Are you taking it seriously? So that's another thing. They also need to see cybersecurity, privacy, investment as not a cost or a burden to the organization. Sometimes we view this like, oh, we need to buy this tool, we need to do training, we need to do this. Oh God, cost. A lot of CISOs, they can tell you how much of the way the way they have to defend cybersecurity investment. So they need to start seeing it in the boardroom. They need to start seeing it as an investment, not as a cost, because when a cyber attack happens, the impact can go beyond, like we've seen, can go beyond financial impact. It can even go beyond reputational damage. It can lead to loss of lives, right? So we need to start seeing it as investment, not just as a cost. So just to wrap up, like I mentioned that ask the right questions, lead by example, see cybersecurity as a business imperative, see it as an investment, not a cost or a burden to the organization.
Thank you. Thank you very much. So we'll come to you, Eric, but we have another question. This is from Job Tewao. He says, the question is, what are the most common cybersecurity vulnerabilities in hospitals? Is definitely a cybersecurity person because he's using very large English. What are the most common cybersecurity vulnerabilities in hospital IT infrastructure, and how can they be mitigated without disrupting care?
Very, very, very interesting one. Good one. So like I said, one major vulnerability I've seen across healthcare industries or sectors is unpatched outdated OS, outdated systems. And maybe because, like I said, it's not an excuse, but it could be because, oh, these systems, they need to work for, the kind of work, the kind of environment we live in, we use it every time. And there's no even time to just shut it down and say, let's patch. We cannot afford we cannot afford for it not to be available. So unpatched OS, unpatched systems, these are major vulnerabilities that we've seen. Another vulnerability we've seen is also lack of training. People are not trained. People take training during onboarding, and that is it. People don't even so in the healthcare today, if you talk to somebody, they'll tell you that, oh, we cannot disclose, we can't share our patients' information. But that information we cannot share, and that is for them, that is security to them, that's the best. But they're not even aware that something as little as phishing emails, are they trained? Somebody might not come to you and say, give me Yetunde Olofinle's medical information. They won't come to you that way. But little small talks, you divulge some information you're not supposed to divulge, you click the link you're not supposed to click, you click on attachment you're not supposed to click on. And those are the kind of trainings they need to have. Not just, oh, do not divulge, you cannot confidentiality. I think confidentiality is like the barest, it's too high level, if you ask me, because of course they will tell you they cannot divulge such information. But these cyber attackers, these hackers, they know how to get that information. So they need to be trained of those tactics and the techniques that they use to get information. So I think, yes, basically.
Thank you. Yeah, so we have two people that have their hands raised, so we're going to let them. Please make your questions short and straight to the point. So Eric, you go first, and then Ibrahim second. So Eric, over to you.
Hi, can you hear me now?
Yes, I can hear you.
Okay, thank you. Good presentation. I have two questions. I'm glad you were talking about investment in cybersecurity. So do you think there's any improvement about that investment? When I'm talking about investment, means also training, everything versus like before COVID-19. That's my first question. And my second question, do you have any law in Nigeria which can push healthcare system or any company from any sector to inform their clients or the users once they go hacked? Like here in North America, we have 72 hours to report. Thanks.
Okay, so I understand your second question. Your first question, you were asking if we've seen improvements in. I'm just trying to rephrase so that just to clarify understanding. You're asking if we've seen improvements in cybersecurity investments since COVID.
Yeah, like the decision makers, if you feel like yes, they are making improvement comparing to before COVID-19. Thanks.
Okay, great. Thank you. So I think that in all fairness, we've seen a number of improvements. We've seen, but it can be better. Maybe a little level of improvement since COVID-19. People now see that, oh, leaders are beginning to see that, oh, this can, actually happen like the way COVID happened. However, it can be more. And, like because it's awareness. They need to be aware. Now, I'll give you an example. Now, in the banking sector, in the financial sector, not just banking, the financial sector, CBN in Nigeria has mandated that the board should be trained. In fact, you should have, number one, you should have a cybersecurity person on the board. So you should have a cybersecurity person on the board. And also the board should be trained. They should be cybersecurity savvy, because it was what you understand that you can, you can say, okay, we need to make this investment. Sometimes it's not like the CISOs or the IT or the head of security or the head of IT, whoever is going to leadership and make that presentation and make that, persuade them to invest in cybersecurity. Not like they don't understand, but the board, the people we are trying to persuade, if they don't understand the gravity of what is at stake, they will still not invest. Now, one area that I said CBN in Nigeria, I tried to step in, intervene for in the financial space, is to say, okay, first off, we need someone that is a cybersecurity savvy on the board. It's a mandatory requirement now. Then number two is that minimum, at least quarterly or maybe annual basis or something like that. I think a minimum per annum, you should train your board, and not just creating awareness, like they should be trained. So they should know what is at, they should know those things that are at stake, what is at stake. And they can then, that is when, because they're decision makers, they're the ones that are going to approve whatever investment we want to make. So when they understand, then they can then approve those. So I think in the health sector, I've not seen any law that is mandating that you should have a cybersecurity person on the board in this X sector, or you should train your board of directors when it comes to cybersecurity. I think in that regard, we can learn from what CBN is doing. The health sector, the regulators in the health space, they can learn from what CBN is doing and say, okay, I think this is a conversation. This is something we can implement. But have we seen increase? Just to answer your question, yeah, I think there's a little increase in cybersecurity investment. But as we are seeing that increase as well, we are also, technology is in fact, it's evolving more than what we are, the efforts. So we need to double efforts so that, yeah. And the second question about breach reporting, what is the reporting timelines and all of those? I know for NDPA, the reporting timeline is 72 hours. Within 72 hours, that you become aware of such breach, you need to report. So yes, we have something like that. And NDPA cuts across. It's not just, it cuts across. Either you are in the health space, any sector you are in at all, you need to, before you collect personal data. And of course, health information is personal data. In fact, it's so you need to report to the NDPC. Does that answer your question?
I believe so. Thank you so much for that. So I think that is all the questions. The next question, the last one is this is very important, is what competency trail are currently available to becoming a cybersecurity expert, and how can one be certified?
So is that question from someone from the audience?
Ibrahim Amidu, yes.
Okay, great. Very, very good question. So it depends on where you are. Like if you're just starting and you just say, I'm interested in cybersecurity. I think it's now becoming, something everybody's talking about, and I want to build a career in this. So if you're just starting, you can I wouldn't say that you should jump straight into certifications. I would say that you build foundational knowledge, and ISC2, you can browse ISC2, Google it. ISC2 has something, ISC2CC. So they have like a free training where that at least that will introduce you to what cybersecurity is about, what a career in cybersecurity looks like, and you can build from there. But there are also a lot of resources that you can also use. If you go on YouTube, a lot of resources. There is Simply Learn. There's Cybrary. Cybrary is a cybersecurity platform that you can learn whatever it is, and you can choose a path. But I wouldn't advise that you quickly choose a path if you are just starting. And that's if you're just starting. I think you should just try to understand the fundamentals, understand networking, understand what even cybersecurity is about, and those basics things that you need to learn. Then you can once you have your foundation or your fundamentals covered, then you need to then specialize, because cybersecurity is very broad, like extremely broad. So you don't want to learn everything at the same time. You want to do like a structured, like a focus kind of learning. So you can say, okay, I want to be a GRC professional, cybersecurity GRC. I want to go into, I like to defend things. I want to be, like, if you watch football, I want to be on the defense team, on the first side of things. So you can choose the SOC pathway. And if you say, oh, I'm an attacker, I like to attack. I like to be the one to strike. You can choose the red teaming, which is the ethical hacking and all of those, that parts, the offensive parts. You can also decide that, if I want to actually go cloud, I maybe, for example, if you already have some cloud competence, you're already, maybe familiar. If you're not as well, you can learn it. But if you're already familiar with maybe AWS, Azure, Google Cloud, and all of those, and I said, oh, I just want to, I'm already in that space. I think I just want to build on that. So you can also go the cloud path as well. If you want to learn DevSecOps, if you're already maybe in that space as well, you can, if you're a software engineer, or you can just say, okay, I want to build competence in DevSecOps, application security, and all of those things. So there are, anybody you always find something, you find your own niche, and you can, or your own area of specialization, and you can, move with that. But if you're just starting, your best bet is to make sure you understand the fundamentals. And I think IFC2 and also some foundational courses can help you with that.
Thank you so much. And we're going to be wrapping up now. We've really done an hour of this. And thank you so much, Yetunde. One last comment someone said is, please, is this going to be a full-scale bootcamp? Thank God you asked, because yes, we have a bootcamp coming up. And because yes, this is an area that healthcare professionals are not fully aware that they can tap into. So that last question was really a great segue into this, because how do you get certified as a healthcare professional? So your healthcare knowledge is your domain knowledge, and you can build on that to get into the healthcare space, to get into the healthcare / hybrid of that cybersecurity. A lot of roles now are hybrid. Digital health is, technology and healthcare and cybersecurity. AI is a hybrid of all sorts of things. So yeah, so there are a lot of things that doctors, nurses can do aside working in the hospital, cutting up people, giving drugs. Pharmacists can do all sorts of things right now. So yes, there are so many things you can do. You can take out specialty courses, specialty courses. So we have a bootcamp that is coming up. I'm just going to quickly just flash this on the screen just to show you. Sorry. Stop share. Just a quick snapshot, just 1 second. So we have, you can go to our LinkedIn page. You will see, Somto or Tinu, can you just share a link of our LinkedIn page in the chat? Oh, we don't have a chat, sorry, but in the Q&A section, and just so that people can see it. So we have a bootcamp coming up, and I'm just going to share that here to show you where it is. So this is what it's like. Yeah, so this is it. You can visit dhsa.org to complete the application form. And this is our post on LinkedIn. So this is what it is like. And this is a call for application. It's a 6-week data privacy and cybersecurity bootcamp. We have some expert leading, you have interactive sessions, casework. We've been working on this for months. We have hands-on projects and simulations, and you get a certificate of completion as well. So you can scan the link to register, and also you can go to our website to register. Deadline is tomorrow night, and it's virtual every Saturday, starting from sometime this month, towards the end of this month. So yes, this is one of those fundamentals we talked about, get a bit of the fundamentals, and then you can now get to decide how to proceed further from there, with, because this is a hybrid of like healthcare and because healthcare data is handled differently, and then cybersecurity. So thank you very much. I'm going to stop sharing, but you can always scan this or go to our website to look at that. So please, if you can paste the link on the Q&A, thank you. They will just do it right away. So as she's doing that, I just want to extend gratitude to Yetunde, who has been very, very gracious to take us through this 1 hour Q&A. I know you're tired of talking. You really shared a lot of knowledge with us. Thank you so much for this time and for sharing all this information with us. I learned a lot of things, really, I did, and I'm sure people also learned things. I know some people here are cybersecurity experts, but also learning some things with a healthcare lens is different, and they're one of the things everybody picks from here. So thank you for the opportunity, thank you for the time, and you guys, thank you for sticking with us for this hour-ish, and we hope you sign up for the bootcamp that is coming and get selected for it, because it's not, I mean, you sign up and then we pick based on application. Competitive actually, and we can start the bootcamp when it's ready. So thank you everybody, and have a lovely Sunday and happy new week. Thank you. Thank you very much, Yetunde, and thank you everybody.
Thank you. Bye.
Bye.